Keegan, Town Manager in Foxboro, with your latest COVID-19 update for the town of Foxboro. So let's go right to the numbers. So as of right now, we've had a total positive number of cases of since March 15th of 48 cases. We've had 23 recoveries, and we have 25 cases that we're currently tracking at this time. That's up 2 from yesterday. Total folks who have tested negative are 323 overall, and we now have 2 hospitalizations, which were added as well. So we just want to make everybody aware that we're up 2 cases, but we're still not seeing a significant change in the number of cases that we've had, relatively speaking, compared to other places throughout the Commonwealth. Right now, there are a total of 17,800 COVID suitable beds that are available. We have 7,270 actually COVID patients, and we have 2,084 ICU patients at this time throughout the Commonwealth. So obviously the numbers are ticking up. A total of 29,918 cases statewide are currently being tracked. A total of 1,108 deaths have been recorded since yesterday, so that's obviously a concerning number. We've actually gone over the 1,000 milestone marker, so we're obviously very concerned about that. So but taking a look at what's happening statewide on a more detailed basis, let's see. So as far as county-wide information, we can tell you that Norfolk County, we currently have 3,122 cases, a total of 149 deaths in all of Norfolk County. We have, in terms of case impact, in terms of ages, there are 5,400 cases in the 50 to 59 age group, which is the largest of all the groups. We have a total of 4,000 cases 80 or older, which is actually quite interesting. And also 40 to 49, there's 4,500 cases, another 4,400 cases in the 30 to 39 age bracket. So the lowest group is the group of 19 years and younger, total of 675 cases statewide at this point in time. Now they've broken down the total of the deaths by age bracket, and the latest information shows that the group from 80 to 90, 80 to 89 is actually the highest group impacted. That's at 399. The second largest group is 90 plus at 281, and the group 70 to 79 is the third highest group at 264. The fourth highest group is the group 60 to 70 at 108. So that's the latest breakdown of all the numbers statewide in terms of where we currently sit. Taking a look at the latest information on the report, a link to the interactive map of public resources created by MEMA is available on the Board of Health website, www.foxboro.ma.gov/department/health/COVID-19 health. That's the latest information, by the way. That was new information that has just come out from MEMA in light of what the Secretary has announced as of yesterday. So we now have the new information up for you already. On Wednesday, Governor Baker announced that an additional 1 million pieces of personal protective equipment is coming to Massachusetts from FEMA. A rapid resource clinical team has been established to help long-term care facilities in Massachusetts during the COVID-19 pandemic should a crisis arise at that facility. The Commonwealth is working to staff long-term care facilities throughout the COVID-19 state of emergency, and has created a portal to apply for available jobs at these sites. A $1,000 signing bonus is being offered for some positions. You can apply at the LTC portal at covid19ltc.umassmed.edu/. In terms of from the MRC, the new website offers a breakdown of cases by county, age, and now race and ethnicity. You can check that website at mass.gov, and it'll provide you with that latest information. State Public Health Laboratory and private testing facilities have now conducted over 132,000 tests for COVID-19. At this point, over 4,000 tests are being conducted on a daily basis. And the administration today announced yesterday that Massachusetts has received an additional 1 million PPE from FEMA. As mentioned earlier, that was another highlight. Long-term care facilities have been a significant area of contention. COVID-19, so since then, almost always at high risk for infection, and care setups make social distancing a challenge. And there are several steps taken to address this need. Mobile testing by the National Guard continues, testing of over 4,500 residents at over 264 facilities. And the state is also providing testing kits to qualified providers in partnership with the Broad Institute at MIT. Over 4,000 test kits have been distributed, and another 8,600 requests are in process. If and when a facility becomes a hotspot for COVID-19, the state has begun sending rapid response critical care teams, including nurses and EMS techs, to care for patients on site. Staffing needs are critical, and so the state has set up a designated hiring portal for long-term care positions with a $1,000 signing bonus available to staff who are able to commit to work a minimum period. Residents who are not in need of acute care but are concerned they may have symptoms are encouraged to use the Buoy.health screening app for guidance on symptoms and next steps. You can go on. That's either done through an iPhone or Apple phone, or through any other type of phone. They have the apps available in both forms. So this helps residents determine if additional testing or care is needed while limiting unnecessary provider visits. Massachusetts hospital bed capacity for the surge currently sits at actually 15,900 ICU and non-ICU beds as of April 14th. 46% of the 17,800 beds are available statewide. So that's additional beds that we've put in place. So we have quite a bit of capacity available at this point in time. The U.S. Small Business Administration reports that there have been over 941,000 applications for Paycheck Protection Program approved, totaling over $228 billion through nearly 4,600 lending institutes. They have also released an update, FAQ online. It was updated as of yesterday. It contains new questions and answers that have been raised throughout the process. My understanding is that there has been that the money that has been appropriated for that program is close or has been actually exceeded to the point where now that Congress is going to have to act on more funding to support that. So, and let me see, additional things here. All the other information I provided to you has actually been done already. And so, a couple things I want to just give you on the local front. The selectmen did act the other night to delay the property tax from May 1st to June 1st. So they'll be without any penalty or interest charges. So just we are in the process of actually working through that right now. But just so you know, the selectmen did approve that the other night unanimously. So that piece is actually in place, and that's a question that has come out. But yes, we wanted to let you know that we have in fact taken that step. So it's really important that's important news for all of you to be aware of. Also, just on the local front, just wanted to tell you that we just another plug for the Eden Foxboro promo. All you have to do is enter to get takeout from Foxboro Eatery. Or Foxboro Eatery, you can post a public picture on your Facebook page or the Uptown Happenings Facebook page. Hashtag Eden Foxboro and hashtag the name of the restaurant. And 2 winners will be chosen each week, and they will each receive a $50 gift card to a local restaurant for your assistance in that regard. Help us support our local restaurants. It's really important that we do that. We really appreciate your efforts in doing that. And we do have a list of open eateries on the Uptown Happenings Facebook page, as well as the page on the Board of Health's page. And so the latest information that we have, a lot of places are doing takeout food at this point in time, mostly in and around this area. There's not a lot going on, I think, up at Patriot Places at this point. You can certainly check their website to see what is available and what is open at this time. So that's the latest information on that front as well. So we are at a point now where we are we are starting to our team. I just met with my operations team this morning. That's the reason why I was running a little bit late in terms of the report today. We are actually doing our meetings virtually at this point through technology. So we're trying to keep our social distance and respect that. But we're also starting to have conversations about how we can actually re-engage at some point. And we need to have those conversations because at some point this is going to lift. And we need to understand, or at least have some indication as to what that will look like and how we will go about doing that. Now, we don't have a set time in place to do that and what that's going to look like, but we are starting to have the conversation and start looking at what opportunities might exist for us to do that. We're waiting for a direction from the governor on this, certainly, of course, from the President of the United States, indicating what kind of steps that will look like. So we're continuing to work on projects throughout the town. Both the water and sewer departments and parks have done a terrific job of doing their projects and working on their efforts. The parks areas are probably getting ready to mow in the next week or two, and they did a lot of pickup over the last 24 to 48 hours in relation to the storm that occurred on Monday, which was pretty significant. Caused a fair amount of damage, and in some areas, in select areas of town, and caused about 600 people to be without power. That has all since been restored, so we're really grateful for that effort as well. Again, just thanks to our fire and police and dispatch and all our public safety entities for doing the work that they're doing, and also a shout out to all of our town employees who are still working, still staying engaged, even remotely, working from home in some cases, but not all. There are some working still here in town hall and at various locations throughout town. So if they still continue to do work that they have to do, and it is in some respects an opportunity for us to catch up on some things that we haven't been able to do in a while. So it obviously gives us that opportunity to do that because of the slowdown in turn that's been created by the epidemic. So we're really grateful for everybody watching and your continued support. We certainly hope that you remain healthy and safe throughout the course of the epidemic, and we'll continue to provide these updates to you on a daily basis so that you're up to date on what's going on in and around Foxboro. Again, if you have information that you want me to share during any one of these broadcasts, feel free to contact me at Keegan at foxboroma.gov, and I'll be happy to put it out for you. Until then, I'll see you next time. I should be on time tomorrow morning at 10 o'clock. If you have anything you want me to put out, I'll be happy to do it. Until then, stay safe, and I'll talk to you then. Thank you.